Hello and welcome to this edition of Ask Dr. Robyn. I'm Dr. Robyn Silverman, Child and Teen Development Specialist and the creator of the Powerful Words Character System. Today's letter is from Gia in Seattle, who writes, "Dear Dr. Robyn, I found myself yelling a lot at my kids. I'm exhausted and frustrated and then I feel terrible. What can I do?" Well, thank you, Gia. Let's face it, many parents are feeling stressed out right now. Between dealing with this health crisis, to trying to help our kids with virtual learning, to attempting to clean the house, to get meals on the table, to get our own work done, it's challenging. Even the most patient parents are feeling exhausted and irritable. I know it's hard to keep your composure, I really get it, but screaming at our kids doesn't work well in the long run. We wind up feeling guilty and our kids are left feeling defeated. So when life gets overwhelming, we all feel like yelling sometimes, but here are a few things to try instead. Number one, take a cue from your own parenting techniques and give yourself a brain break. Make sure everyone is in a safe place and grab some alone time. If you feel like your blood is boiling and all you want to do is scream, go into your bedroom, the bathroom, the basement, the closet, and let that emotion out if you need to do so. And while you're in that separate space, breathe in and out to relax your body and mind. Studies tell us that yoga breathing with deep inhalations and exhalations can do wonders to calm the body and brain. After a few minutes, you'll feel much more in control of your emotions. So yes, give yourself a break. Number two, speak so that your child can hear your words. Often when we yell, our children can only hear our tone, but not the message that we want to convey. They know we're angry, but they don't know what they should do or not do to help the situation. So speak in a serious tone so that they know you mean business, but speak quietly so they tune into the words rather than the screaming. Be clear about the behavior that you're finding frustrating, being careful to show that it's the behavior, not the child, that is making you feel anger. Number three, see it from the child's perspective as well. Why is your child acting this way? Are they trying to convey that they want attention, that they aren't feeling heard, that one of their needs isn't being met? While you are frustrated, your child may be as well. So look at the situation rather than just the behavior. On the How to Talk to Kids About Anything podcast, I interviewed Mona Delahook, who talks about the behaviors being the top of the iceberg that we see, but there is a lot we don't see beneath the surface. So if your child is running away when you're trying to get out the door to the doctor's appointment, perhaps they aren't trying to anger you, but rather tell you that they are scared to go see the doctor. If they keep getting out of bed, perhaps they aren't trying to keep you up, but rather are feeling anxious about something that happened today, that's happening tomorrow, or just in general, given what's happening in the world right now. So dig in a little, and you can address the problem rather than the symptom of that problem. And finally, remember, you're human. You are going to lose your composure sometimes. Give yourself some grace and know there's always tomorrow. You can apologize for losing your cool and try again. That's all for this edition of Ask Dr. Robyn. Please continue to send in your questions and it may be featured next month. In the meantime, I hope you make it a very powerful month. Thank you, everyone.